So I want to share 3 nursing specialties that I think or that I've loved working in as an internationally trained nurse, okay? I see a lot of internationally trained nurses. They come over and they work in long-term care and med-surg. Now, there's nothing wrong with working in long-term care and med-surg. It's perfect. Somebody looking for something more, or if you're a new internationally trained nurse and you're trying to play around with your career choice, there are 3 specialties that I have worked in that I really like. So I'm gonna start with the least to the best that I think, okay? So the number 3, is perioperative nursing. So operating room nurse. I don't see a lot of Black people in the operating room. Many places I go, because I work at a site and I work also as a travel nurse, and every time I go to places, I'm always like the only Black person there. I'm like, where are you guys? Where are you? Like, why are you afraid of the operating room? Like, what is going on? Come and talk to me. Why are you scared of the operating room? I want to see more of you in the operating room. Now, one thing about the operating room is that it can be challenging when you're starting because you have people with type A personalities. Like, they are crazy, okay? And when you're starting out new, you have to go through a lot of training. You have to follow instructions. Now, if you are unlucky like me and you find yourself in a toxic workplace, because like when I started in the operating room here in Canada, I worked in a very toxic environment and it was hell. It was really bad. But if you're lucky, and I can also share with you some of the operating rooms that I've worked in BC and Alberta that are amazing, that you get really good training, amazing people. So send me a DM or make a comment. Let me know if you want to know which operating room you want to go to, and I can tell you. But once you get, so because the operating room, there's a lot of protocol, things have to be done certain ways, because you're dealing with a lot of, like, you're trying to prevent infection, you're dealing with like critical patients, you have to be really good at what you do. So your training is usually very specific, very tough, but it helps and things get better if your preceptor is kind, if your preceptor is ready to teach you and they accept you. But if they don't, then it's hard, okay? But like I said, email me, DM me, and I can give you a list of operating rooms that are really Black friendly, and you can go get your training there. Because right now, the reason why operating room is really great place for Black nurses is that once you get your training,